Hey, welcome to another video from SkinnyMedic. I have an after-action medical report video for you. This is where I take a video footage of a real incident and I go through and break it down for you, hopefully to help you, because you never know when you'll be the first responder. This one, I got tagged on Instagram and was posted in my SkinnyMedic Facebook group, and it is a doozy. It's pretty graphic. There's not a lot of blood, but there's definitely that shock factor, so YouTube is not gonna like it. They're gonna instantly demonetize it more than likely, and they're gonna say that you have to be 18 or older to actually view it. So I do appreciate Sonoran Desert Institute for sponsoring this video. I'll put a link down below. If you're looking to learn more about these things back here, how to work on them, things like that, Sonoran Desert Institute is a great place to get started. So like I said, here's the video. We're gonna watch it first. I'm gonna put a viewer discretion is advised. We'll watch the video, we'll come right back.
Güey, avisar a la entrada, güey, que tengan ambulancias, bomberos. No te quieras salir, güey. Avisar a la entrada, güey, que tengan ambulancias, güey.
So, what do you think? It's like a Dune racing, like a buggy of some sort hits another vehicle, and man, you got a lot of people injured. That was the first thing I thought about. You know, we're thinking about scene safety BSI. Scene safety is probably taken care of. I don't think there's anything danger here. Let's put our BSI on PPE. And then one thing to think about is how many patients do we have here? Looks like we have at least 3 patients. So if you're calling 911, we need to let them know that pretty doggone quick, because how many people can go in the back of my ambulance? 1 or 2. If I have 1 critical patient, that's probably all I can handle. Maybe we can throw a second one in there. It's not really super injured, but I probably need 2. Probably looking at this incident, we have 3 patients. We have one guy that's the dramatic one right here, with the legs, but the female is, I'm concerned about 2. So we have at least 3 patients, 2 I believe may be critical. So we need to tell dispatch that. Let's tell them we have 3 critical patients, because we may need 3 ambulances on the way. It's gonna take some time to get them to the ambulance, because it looks like this is sand, things like that, not the easiest environment to extricate people out of. So we need to get resources coming very quickly. The camera really focuses on this guy with the legs, and yes, we'll talk about him. But like someone else noticed in my group, look at the lady in the back. She's not moving. So we've talked about in other videos talking about triage. Absolutely, you need to triage here, because you're probably by yourself, you have limited resources. So think about who you can treat first. The girl in the back doesn't look like she's moving. So she may have an airway problem. She may have something you need to fix immediately before the guy with the bilateral broken legs, okay? So let's look at triage. 30, can do 2 is probably the easiest thing to do. Is a respiratory rate greater than 30, capillary refill is greater than 2 seconds, they can't follow commands, can do, then they're gonna be a red tag, they're gonna be immediately transported. So typically it's like, hey, if you can hear the sound of my voice, stand up and move towards me. That gets you green tags, okay? They probably don't need you as much. And then let's go. Let's look at these people and assess them. You're not going to check for a pulse like that, but I can go to that girl, look at her respiratory rate. I can do a capillary refill. Hey, can you wake up? Can you hold 2 fingers up? Kind of see if she can follow commands. That's going to let me know her mental status and how she's doing by her vital signs. And when you are assessing these patients, get their mental status. Are they alert to verbal, painful stimuli? Are they unresponsive? Do they know where they're at? Do they know what day of the week is? Who's the president of the United States? Some simple questions that the average adult should be able to answer. That'll kind of let you know their mental status. Ask if anybody got knocked out. If you saw anybody get knocked out, those can all help lead to ruling out or ruling in head injuries. Let's go back to this guy here. He has bilateral broken legs. They're not mid-shaft. I think they're just above the knee. But man, he could be in some bad shape. If it took enough mechanism, enough power to break both of his legs, imagine what his pelvis looks like, his hip looks like, what his internal organs may look like. So the distracting injury is those legs, okay? Now those could be deadly, not saying they're not, but you can lose about 2,000 cc's of blood per leg. So that's 4,000 cc. We have somewhere between 5 to 6 inside our body, depending on, you know, things going on. But that's a lot of blood volume that can be lost inside there. So not saying he's not sick, but those legs are distracting injury. We need to pull him out, get him going to the hospital super quick. I think a backboard probably is the easiest way to get him out. and get him going to the hospital. Thinking about the girl in the back, seeing if she has any airway, breathing, or circulation problems that we need to take care of. And then of course the driver, let's take care of him. Also check the other vehicle, make sure there's no one injured in that vehicle as well. Thinking about extrication, how we're gonna get these people off to a normal roadway. Can we use another UTV, things like that. Let's start getting some bystanders together, be my mindset. Can I borrow a UTV to go to the roadway? I need to meet an ambulance, things like that. And start utilizing your resources around you to get these people to the hospital as quickly as possible. So when we go to assess these patients, let's think about the MARCH algorithm. Massive bleeding, airway, respiratory, circulation, and heat loss. When you find something wrong with it, you fix it. Find someone with massive bleeding, let's fix it. You find someone with an airway, let's take care of it. If they're not breathing well, let's fix it. Double check everything in that circulation part, making sure you're not missing anything. And then H, hypothermia, heat loss. You can throw in head injuries there, especially for this scenario. Something definitely to think about. So thinking about that femur fracture, sometimes we do utilize a traction splint in EMS. It basically secures to the leg, and you can pull traction on the leg because the femur's broken. We use it for a mid-shaft femur fracture, so it's broken, and we pull it apart and kind of set it like this. Really helps with pain. It's not moving around, doesn't nick the femoral artery, stuff like that. But this one looks like it's a lot closer to the knee, so I would not want to put a traction splint on that because it may be some knee involvement here. So when you go to pull that, you're actually pulling the knee apart as well. Super painful. So I would just use a backboard, secure them. I think the backboards would ease of movement. Normally don't like using a backboard, but in my opinion, I'd probably use a backboard just to get them off out of the buggy into the stretcher and move as quickly as possible. So I hope this video helps. You never know when you'll be the first responder. Remember, you need the right gear and the right training.